with the gross anatomy of the hamstrings, we'll go to the book here. So as we mentioned before, 3 out of the 4 hamstrings attach to the sitting bone right here. That's located when you place your hand on your buttocks and move downwards, and the first bony protuberance that you'll feel will be the sitting bone. Now, 2 out of those 3 muscles are attached, again, from the ischial tuberosity, the sitting bone, and they'll travel down on the inside to attach to the major shin bone. One of them, which is deeper than the other, attaches to the back of the shin bone, and the one over here that sits on top of this one attaches to the side of that shin bone, along with the other muscle that we've encountered, which is sartorius in the pes anserine area. Now, semitendinosus, named because it has a longer tendon than membranosus, is also used for a tidbit of information used for operation of the ligament in the knee, that if there's a repair that has to be done, they'll take the tendon of the semitendinosus because it already has a synergist, which is this muscle, in bending the knee as well as on the same side. Now, the other muscle that attaches to the ischial tuberosity, the sitting bone, is the one on the outside. It has 2 muscles. This is one that's the longer one, and this is the shorter one. Both together are called biceps femoris, bi meaning 2. And both of them attach to the outer side of the shin bone. So there's 2 shin bones, the inner one and the outer one. So the outer one, called the fibula, they both attach to there. So this is the back view. And the inside one here, that's this muscle that attaches there. And the semitendinosus attaches here in the front view. So that's where the pes anserine area is located. Now we're going to move to Frank. So with Frank here, we already mentioned that 3 muscles attach to the sitting bone. The other one attaches to the thigh bone here. So the 2 that attach and move downward to the inside, one of them attaches down here, and the other one attaches to the inside of the shin bone. The third one, the long head of biceps femoris, moves down and out to attach onto the fibula here, along with the short muscle that attaches there. Their actions is hip extension and knee flexion. So those are the 2 actions of the muscles. Now, I'm going to move Frank a little bit off to the side. I'm going to go back to the book and we'll go back to Frank afterwards. But I just want to indicate to you about biceps femoris. We already mentioned about the IT band that sits on top of the outside quad muscle. You can see how close the biceps femoris and the quad muscle are. So when we do some self-massage techniques, we'll be rolling both the outside quad muscle and biceps femoris and try to get in there with our massage ball to kind of separate those 2 muscles. And over here is another picture where it shows the IT band here and then biceps femoris. So they're very close together, close to the knee. So we're going to address that area as well. So the next segment will be performing those massage techniques on those 3 different positions. So the first position we're going to do for the massage on the hamstrings will be in the standing position. With that, we're going to use 3 different type of tools. We have the massage stick, the rolling pin, and the broom handle. You can also use the bat as well. So in the standing position, you have the massage stick, one leg forward, you go behind to address the hamstrings, and move to the inside to capture the medial hamstrings or inside hamstrings, and then the outside So that's with the stick. You can also use that with the rolling pin and with the broomstick. Yeah, just a different tool to use if you don't have a massage stick or rolling pin. Good. Now we're going to move to a seated position with the chair.